Hello, hello, hello. Welcome to the show, everyone. I'm your man, Stan the Man Martin, coming at you live. I'm here today. I'm flying solo today, y'all. Kind of a little bit. My colleagues, Ebony White and Samantha, they couldn't be with us today, but that's all right. As James Brown used to say, the show must go on, and there's no business like show business. But no, thank you all for joining us today wherever you are. Welcome to Reach. Reach stands for Racial and Ethnic Approaches Toward Community Health. We're live and coming at you from Buffalo, New York, the Queen City, as we stay here. And if this is your first time joining us, Reach, our work is centered around increasing access to food and nutrition, improving relationships, linkages to community services, as well as tobacco prevention, and increasing COVID and flu vaccination uptake, specifically Black and Brown communities. And that's really is where our work is focused in. So if you're joining us from the East Coast or West Coast or down south or way up north, let's just give you a brief overview of what Reach is and what we're doing in terms of our work. I'm very excited about our guest that we have joining us today. She's a friend and she's a colleague, a champion in the community. Without further ado, let's welcome Miss Bernadette Giles to the show. How you doing, Bernadette?
Thank you, Stan. It is a pleasure and an honor to be here today. And hello, everyone that is out there watching and joining us today. And I'm feeling pretty good today. How are you today?
I'm blessed and I'm highly favored. How about that? Let's burn it down. Let's just get right into it. Let's spill some of this tea. I had the pleasure of working with you and knowing you, but tell the folks a little bit about yourself. Where you're from. Not too much now, but just a little bit.
Definitely. I am Bernadette Giles, she, her pronouns. I originate from Western New York native. I'll say Buffalo born and bred, but then, some of my family that is from the city of Lackawanna will be offended. So by way of Lackawanna, I went to Hutch Tech High School in Buff State. I am re-entering Buff State for a master's in creative leadership. Was in law school for a little bit, but this opportunity to join the Cicatelli Associates came along. So I put that on pause, and that's basically a mother, creator, and just truly, I'm gonna say, an educator and a lifetime student of just life and figuring out how we can make this a better community, or how our community can be a great place. Continued great place, I guess.
Right. Well, like I said, wow, I didn't know you was from LA. That's Lackawanna, y'all. Not Los Angeles. That's a local, y'all.
Yes. I left when I was about 8, but still, they don't care. They don't care if they know your mom or your daddy. You're from there.
Right.
I can say I went to Waterfront 68. They do not. They like, oh, you. So yes.
But tell our audience, saying like how long you been with CAI and your role within the organization.
Yes, so I have been with CAI for a little bit over a year. I am the manager of community and youth engagement to promote health equity. A longer title, but it kind of says it all. Like, I have the pleasure of doing things that I was doing axillary. CAI really focused on community-led initiatives. So I have the honor of being to work alongside the community and ensuring that our work is centered around what the community prioritizes, like using a true community mobilization approach to really center our work and saying this is what the community said, this is how the community wants this to be broached, and then so I have the great work of being with the community, identifying, and then bringing them to the table, or making sure that we have a place at the table. So, but CAI makes it easy, so it's great.
Oh, okay. Let's lean into that, a little bit more. I know you mentioned health equity. Like from in your words, what does that mean for our audience? For those who might not be familiar, with it and etc.
Yeah, thanks. Great question. Because health equity to me is more like an actions more than you just define it as the meaning of. It's really how do we create? It's when we create the opportunity for every person to have access to, health providers, to everything that will make their life healthy and successful, right? So it's kind of positioning ourselves to look at what are the disparities or health apartheids that are faced by communities and addressing those issues. So and I leading even further into like the CDC definition, it kind of says the same thing. It's like, it doesn't say like health equity is, it says health equity is achieved by, right? Like that's how they kind of word it and start. So I think like health equity is like, how do we get to this place? Like we say, oh, you have the opportunity to have, I'm gonna use health insurance, right? Everyone in New York State has free health insurance, right? Like there's an opportunity to have that if you want it. But the barriers that are in place for certain individuals to get it, health equity is how do we address that? How do we make this fair for them? Not equal. We equally have free healthcare, right? But the equity part is how do we leverage like the steps and the stools that may be needed in order for a person to access that. So.
Yo, that's deep. Wow. Okay, I appreciate that definition and from your words saying like, the fairness, not being equal, the fairness, and you gave some great examples. So, what's it like working with youth, and what's it like, working in the community? I'm seeing and feeling a lot of your passion, a lot of your heat. What's it like?
Yes. So I feel like the youth, and again, I have to lean on like Cicatelli and Associates really recognizing that they're the ones that are going to carry this work forward, right? And understanding that they are the community, although we may, in the wording, say like even in my title, youth and community, but youth community is a community, right? Like they are a part of the community. And I think that inclusion and reminder of like, they know what they want as well. And there are things they might not know, and there are things we don't know. So I think that constant, like being an educator, but also being a student, like, being able to give them some things and lift them up into their leadership roles, but also being able to take back some of those gems and being like, oh, this is something that we didn't look at, or we looked at it differently. We thought this was going to be this, like they asked for this, and really prioritizing them in every step. And we do that with community, but I think sometimes, when you're in these roles, you forget that the youth want to be a part of every step too. They want to be a part of like the beginning, the creation, all the way through the implementation and the change that's going to come.
Yeah, wow. Like you said, the youth want to be a part of it from the beginning, the middle, and the end. I appreciate that. And you mentioned about the community piece. How do you work with like when we say community, because people throw that term out there, loosely. How do you like break that down for us? When you think of community in your work, how does that manifest itself?
Yes, great question. I think like in our work, it is who the community is, who we are in that moment. I mean, the community is Buffalo, right? Like for us, for the sake of this conversation. But in that moment, sometimes we have to draw back and really, really hone in on an area that, recognizing like, oh, I can't serve this entire space, but I can start right here. Well, I have to make sure that wherever I start, that community is represented, because going in and then saying, hey, we'll use, a grocery store, you need more fresh fruit and produce, so therefore this is what you need. But the community may say, I don't want that at all, because they live there. They know, and understanding that like while we may have, like, the community has the experience, which makes them the expert in their lives, no matter what age, right? So going in and it being really intentional about, if I'm coming in, thinking of every community as this is their house, right? So if I'm gonna come into your house, into your backyard, I need permission. And I need to work with you. So really saying, we're here, with reach in our zip codes. I need to ensure that the representation of the community is here as well. And is, again, like, that's how we lead, community led, is ensuring that the representation of the communities that we are serving are with us, alongside of us, and are the decision makers. So that's what it means.
Yes, yes. Thank you, Bernadette. You definitely dropping some jewels. But man, you spilling the tea this morning. If you're just joining us for the first time, I'm here with my friend and colleague, Bernadette Giles, manager and youth and community engagement, for health equity. And, she's dropping some jewels, y'all. So, if you need to find out more information about her, we're going to give you that. That's a little teaser, at the end, how you can join some of her work that she's doing. So, you got to stay tuned. We're talking about Reach Buffalo, racial and ethnic approaches towards community health, and how we're engaging youth and engaging the community. The community has the answer, as Bernadette was so eloquently, sharing with us a moment ago. Why is Reach Buffalo important? Why do you think, it matters, Reach Buffalo, Ms. Bernadette?
Well, I think it matters because, as we are aware, like, there is a lot of chronic illness and disparities throughout our city. And Cicatelli Associates, before getting the grant, really did some research and some mapping around where those disparities was. But we know, like, access is a big problem in the city. So Reach Buffalo really drawing attention, bringing in those partners, and again, being community led. So really saying, like, the community is saying these are the issues and these are the things that they would like to address. Really allows that opportunity to address the health inequities, and, like I said, the health apartheid that our communities face, right? Like, we understand the food apartheid, that's a part of Reach, and different focus areas. And I might be getting a little ahead, but there are really some areas that we hone in on, or that we concentrate on. So it is a necessary, because of, and especially in the African American community, which is the priority population that Reach, addresses some of the health inequities that are faced. So Reach Buffalo is important because it uplifts a voice, it creates a network, it brings, stakeholders and partners to the table to really, look at what is going on and how can we change this, and how can we make this more equitable? How do we address this, but in a real sense, not just in conversation, but in action? So I think that that's why Reach is very important.
Great. Thank you. No, I appreciate that overview. For our listeners, we got some of our music. We're changing our CD right now, so we're gonna have our music come back shortly, a little interlude, what have you. But Bernadette, you mentioned initiatives. What are some of the initiatives that you're a part of, in terms of Reach, and what's some of the outcomes that you're seeing?
Sorry, I was about to start talking and didn't have myself unmuted, so I apologize.
No, there you go.
So, so yes, so Reach has a couple of focus areas. We focus on nutrition, breastfeeding, and tobacco. So I'll start in clinical linkage as well. So starting with the nutrition, we look at food access and really hone in on our priority population, which I believe you had stated at the beginning, but just for those that are just joining, we our priority population is Black, those that identify as Black or African American residents who reside in the zip codes of 14218, 14209, 14211, 14213, and 14215, but along the ferry corridor, if you will, in which, to make sure that we're holding on in a environment that we can kind of, or demographics in which we can kind of be able to have the community and say, hey, if you live here, we want to hear your voice. So it goes all the way back from Niagara Street all the way back to Bailey, and sometimes a little bit further depending on, like that, again, when we're thinking of access and when the community is saying, hey, we need this here. So the big idea when we think of like food access, or all of these, when we think of the focus areas, the bigger picture is how do we reduce or eliminate? I'm not even going to say reduce. How do we eliminate the number of diagnoses and chronic illness for Black Americans, right? Like, how do we, engage a community in a way that helps us shape and create strategies and ultimately policies that will be most effective in our communities? So when we're looking at nutrition, we're looking at food access. How do we increase food access? What does that look like? What does the community believe that look like, right? And when we're looking not just at strategies and that, but like, so even if we increase having things in our area, how do we increase the knowledge of just even selection? So there's different strategies that are utilized in that to increase awareness around, foods and utilization of them, but also increasing the access to them in our communities. Number one. Number two, apologize that was a little lengthy, but they all kind of go hand in hand. But like breastfeeding, there was a time when the numbers were, or it was believed that Black women did not breastfeed, and there was a lot of myths around why we did not. So we really, in our communities, honed on education and support of Black mothers breastfeeding and the benefits, but also the support, like the mental support, and breaking some of those, old narratives and things that may be arising. And there's also the tobacco work, which I know that, I'm just going to touch on it a little bit, Stan, because I know like you are the guru and definitely can share on that. But we do a lot of work at educating and policy building and creating tobacco-free, environments, working with multi-unit housing along our Ferry Street corridors, along with businesses that are within there, and just kind of educating the community on the risks and how this impacts some of the chronic illnesses that we face, like diabetes and just the effects, or how it can be a comorbidity to some of the other ailments that our communities face. And in addition to that, with our clinical linkage, we recently, we have some clinician partners that work with our community. And not only are we doing referral and linkage to them, like saying, hey, these are individuals that the community said, yep, that's my doctor, or that's my, and I feel like they hear me and work alongside of me. We also just had a diabetes management, self-diabetes management course that was recently piloted in our community, which from the community was like, this went really well. So it was a little bit, we changed some of the things to make it feel more suitable. And all of them, our community wellness champions, which those are the focus areas. But again, as we had said, like, it's community led. We have our own advisory board who every step of the way are the ones that are kind of letting us know where we need to be, what is going on, and helping us with the design and implementation of all of it. So they've been kind of the glue of all of the focus areas and projects.
Wow, that was a lot. Definitely. I mean, when you think about reach, the program itself has a extensive reach, and it's engaging, the community, those deeply, impacted by the word in the word. So thank you for that overview and that information. You mentioned about knowledge transfer and people creating some behavior changes. And in addition to access to services and opportunity, as well. Are there any successes in particular that you will? I know there might be many. Is there one in particular that stands out, to your mind when you think about the work that you're doing with youth, in the community as it relates to reach and working with community residents? What would you say one of your successes would be?
I would say, which again probably went into the nutrition or all of it, is the community wellness champions from the beginning to end created and were and now is housed. They did these walking routes, and it was a part of not just exploring the neighborhood, but also, getting out and getting active, right? So, as we are a partner of Active People, Healthy Nations, as well as a part of Reach, Reach Buffalo is a part of the Active People, Healthy Nations initiatives, but it allowed them to, look at just how we are in our neighborhood, and also from that then draw on like the different parts of our neighborhoods, as they created these walks, like just looking at the subtle changes, and even as little as the sidewalks. And it began now where we're looking at how other things can be changed by it, but those walks are now housed on I'm not going to remember right now, but on a website where others can now go out and take these walks and also get information about the architects and the history of some of Buffalo. So that's like one of my big, because it not only got people active, it got us talking about change. It got us talking about other things that can come about. So it started with just like, hey, let's just enjoy our community and how we can get our neighbors out and just exploring and not thinking about our community in a negative way, or in a like, oh, this looks like this, because it was like, oh, I remember this used to be here. So that's one. There are a ton, but that is one of the major, because it has branched out into other initiatives that we are beginning to explore.
Yeah, as you would say or have said, Bernadette, that's dope. That's dope, because you're looking at not necessarily at what's wrong, but what's strong. And what Buffalo strong.
And what can be again, right? Like, so when they're looking at, they're like, very and sharing, like, what again, when I talk about the youth, sharing that, because we had from as young as 9-year-olds all the way up to 78-year-olds sharing in these walks and participating in them. And we also again included all the focus areas. So we had, vendors giving food and fresh fruits and vegetables to, community members as well, and then sharing about reach. So yes, it was very dope. It was
Right. Well, no, thank you. We've talked about a plethora of different initiatives, focus areas, under reach. How can those who might want to get involved with some of your work, how might they contact you or find out more just about reach, about reach in general?
So yes, I definitely encourage anyone to check us out, or if you would like to get involved, to go check out caiglobal.org. And we are under one of their projects. Reach, you can find Reach there. You can reach out at reach.contact@cai.org as well. Or again, you can reach out to me directly at bgiles@caiglobal.org. I think definitely check out the website. There is so many things and more to come, and you can learn a lot about what we're doing, where we're doing it at, and even how to be a part of like a group like the Community Wellness Champions.
Right, right. And I think that folks they can also follow us on Reach at Reach Buffalo on Facebook, as well. We've talked. I want to thank you again for being on the show. Is there anything you'd like to add that we didn't discuss yet, or touch upon at all? Bernadette.
Yeah, I'll just say that understanding that the community has the answers or know better than any one of us, just really, really, really come join us, come alongside. We are always looking and interested in partners and partnerships, and that is the way that we're going to address health equity, right? Is when we really come together and kind of ensure that the community is represented and that the community is heard, and that, increasing that network for the community to be heard, because, that's really just, again, we're community led. So the community needs to lead the change. So that's what I really.
Right,
also apologizing for my door. I know this is live, so apologies that I didn't disconnect, but appreciate you guys.
Oh we're good. We're good. You've been great. I want to thank you, for your time and for the grace, for being a part of Reach Talk. Once again, if you want to find out more information about Reach Buffalo, you can go to @Reach Buffalo. Follow us on Facebook. Check us out. We have some dope articles, some dope information on there, as Bernadette would say. And I want to also give a shout out to my colleagues, Ebony and Samantha, that couldn't be with us today, but also to our producer and extraordinary engineer, Ms. Angelita, who's behind the scenes making it all happen. All right. So without further ado, stay safe, stay strong, and we'll see you all again on the other side. Take care.
Reach Buffalo, promoting a healthy community. Reach, racial and ethnic approaches to community health locally in Buffalo to reduce racial and ethnic health disparities and rates of chronic disease. We want to make a change by reducing exposure to tobacco in housing and work areas, by increasing access to nutritious foods, by creating a breastfeeding community, by increasing referrals to primary care and community health providers, and by implementing community work groups. Reach Buffalo will concentrate on Ferry Street itself, as well as a community that resides within 4 blocks to the north and south of the corridor in 5 zip code areas: 14208, 14209, 14211, 14213, and 14215 in Buffalo, New York, with disparities in rates of chronic disease. Get involved. Ferry area residents will have an opportunity to have a platform to voice their opinions, organize, and make decisions in these efforts. For more information, you can contact Ebony M. White, Community Outreach Coordinator. Buffalo's WDAP Radio.